Assalamu alaikum wa rahmatullahi wa barakatuh. Hi, and welcome back to another episode of Beyond This. Today, our discussion revolves around self-care, how our skin changes over the years. For someone like me, please don't be fooled. There's really great lighting and great cameras in the room that make us look like we have flawless skins. We really don't. Filters, media, TV, everything changes according to how it's presented. But we want to talk about the real life flaws, the real life issues that we have, how our skin changes, the invisible market that we are to the beauty industry, and how we actually learn to love ourselves and to take care of ourselves during these ages. I'd like to welcome into our studio with us Dr Zaheda Bhabha from Dr Bhabha Aesthetics. Assalamu alaikum and welcome.
Wa alaikum salam. Thank you for having me, Zaheerah.
Zaheda, we've had these discussions off air, but it's something that's always concerning for someone like me who's always had skin issues. I almost felt like I got to a stage in my life post my pregnancies where my skin was now breathing and okay and comfortable. And then over 40s hit and our skins go through this turmoil. When they ask me what kind of skin I have, I don't even know how to answer that anymore because there's this dehydration, there's this dryness, there's pigmentation. There's a number of issues that women face with their skins. And no matter what we want to say is it does affect us. It affects how we present ourselves. It does impact on our confidence as well. Let's start there with all the myriad of issues that we need to be facing.
I think the most important, or a very important thing that we need to understand is that in our 20s, our skin behaves 20. It's irresponsible, it's happy, it does all the things it wants, it sleeps when it likes, it wakes up. If there's a pimple, you put something on, it's gone. Unless you're suffering from acne, then it's a different story, but we fix that. When we get to our 30s, we often will say, okay, fine, exactly like you said, we're having our babies. For the most of the women, they have their babies in around their 30s. They stop their contraception. So now remember, from about 18 to about 26, you're taking oral contraception because you want to not have a baby. You want to fix the hormonal changes in your skin. There already we're stimulating some of our melanocytes to become pigmented or hyperpigmented or hyperactive. But because our skin knows how to behave, it's still young. So like the rest of our bodies, our joints, everything, it's all young. It happily goes and zaps up the pigmented lesions and takes them away and resurfaces and remodels. Then you reach your 30s. You stop the oral contraception, but you double the hormone by having your babies. So we're still okay. We're young. We're getting there. And then you come to 40. And you've had the babies, maybe 3 pregnancies, maybe 2 pregnancies, maybe 5 pregnancies. And at 40, you start slowing down with your self-care because you've got a lot of babies to look after. You've got kids, you've got school rounds, you've got to be in the car, out of the car. We don't eat properly. We don't sleep properly. We don't drink enough water. We don't put enough sunblock.
Yes.
Okay. The biggest problem is we don't put enough sunblock. And then we find that suddenly there's a spot, and then there's few spots, then there's melasma. Then there's adult type acne. Then you're sitting here thinking, oh my God, I thought my acne was finished when I was a teenager, but now I've got large, big pimples on my chin, and what's going on? It's because our collagen is declining, right? 1% from the age of 20 per year, and it doubles in your 30s and in your 40s. So we're losing a lot of the collagen. So the drooping and the sagging is starting. Our bones change shape. So the muscles that we once knew. So I also say to people is that I look nice, but I don't look like I did when I was 20. Because everything is changing. Your skin is changing. The muscle positions are changing. The fat pads are changing. And what we're doing to our skin should be changing with that. So we should be drinking enough water. I mean, there's a lot of fads, people drinking all this collagen and putting it on their faces. And it's great because it's going to condition your skin, but it's not fixing the problem. Fix the problem, we need to find the problem, identify it, fix it.
So you mentioned just now about the different phases that we go into and our different ages. And I think the one thing with it we have to accept and we have to understand, like you said, in our 40s, is we're not going to look like we're in our 20s, and we shouldn't want to look like we're in our 20s, because our skins, our bodies, our faces tell the stories of our experiences of the years that we've been through.
Absolutely. And I mean, and this is where aesthetics is it's interesting, because people think aesthetics is me wanting to look 20 when I'm 46 years old, right? So I can't look 26 years old. It's not possible. But I can look the best that I can at 46 or 47 or 48. And that's what we have to aim for. We're not aiming to look like we did in our 20s. It would be nice. But I mean, how many people can say that they look like that?
And the thing is that beauty isn't about perfection. It's about presence. It's about having the confidence to own it. And like Zaheerah said, being the best of you, but it's bringing all parts of you into one space.
Absolutely. I mean, this whole thing about using youth making filters, it's silly. Maybe let's just don't put a filter today and say, okay, how do I look? Am I happy? Does my skin look happy? Have I drank enough water today? Have I exercised? Have I used my retinol? Have I used my collagen supplement? Have I put my HA? Have I put my sunblock properly? Those are important.
Absolutely. But now you brought up a whole lot of words that we keep seeing being thrown at us, from you have to have your retinol, you have to have your niacinamide, you have to have this, that. Oh my gosh. When I read it, I'm like, it's so overwhelming. I almost feel like
it's too many words.
It's too much, and people don't understand what works for them and what is appropriate for us at this age, what works for us, what's beneficial for us, when to take it, when to have it, where do we start?
Much and where to let's start with where to start.
Right.
So over the age of 35, we should all be putting a retinol into our skincare routine. Remember that, I mean, I'm going to talk for darker skinned people because we are now pigmented, and we can't use as much retinol as a lighter skinned person, right? So we need to add our retinol maybe 2 times a week at night before bed, after applying your moisturizer. You need to apply retinol on top of the moisturizer because it needs nice moisturized skin to work. What the retinol does is it is going to cause exfoliation of our older dead skin. Now remember that when we're young, our skin exfoliates quickly. In our 30s, it's kind of a balance, but when we get to 40s, it's a bit sluggish. So unless you're somebody who's going regularly for a skin peel or you're exfoliating, your retinol is a must. You need your retinol to resurface your skin, to restructure your skin, and to make nice collagen to form underneath, right? Then the other important thing, you mentioned niacinamide. It's a very nice product to use. It's nice for calming the skin down and for inflammation. So it's nice. It's nice to have, but you don't always have to have it, right? The thing you have to have, go and have the retinol. Find one, a good one that you can afford is the most important. It doesn't mean the most expensive one is the best one. Everyone should have one, and I promise you they are affordable. There are different products on the market will tell you the way that it's becoming bioavailable to your skin, how much of peeling you're going to get, all of that. It's important to discuss with the person who's prescribing it for you, because some people may start once a week and then you're going to go on to 3, one day, then skip 3 days, then again use it. And then there are other people who use it every second day, and some people can use it every day with no issue, but you have to start slow. The other important thing is hydrating your skin.
Yes.
Okay. Drinking it, hydrating your skin, and making sure you've got the right amount of moisture for your skin. Because in winter, and I don't know, I'm sure a lot of women experience this, the skin gets much drier.
Absolutely.
Very dry. So your summer skincare moisturizer is not the same as your winter one. You should think about the consistency, the thickness, how absorbable it is. So make sure that one is a rich, nice hyaluronic based one. So hyaluronic acid is your moisturizer that we get on the inside and we can put on the outside. So that's nice for your skin. What else did you?
So now just coming back to that, I know sunscreen you mentioned, we live in a country like South Africa, regardless of whether the sun is out or not, we need to be using sunscreen all the time. All right. And then we spoke about hydration, which I think we often forget because I think so many of us, we're constantly running. And as women, there's barely time to take care of yourself. So many women go, there's no way I can sit and do a 20-minute routine, looking after my skin in the morning and in the afternoon, something else, and in the evening. So for women in their 40s or 50s who are just busy, what would be your ultimate must-haves in a skincare routine?
They must have a good cleanser, a good day cream, and a sunblock, right? That's important.
Perfect.
Those 3 things, non-negotiable for the morning. For the evening, you're going to use the same cleanser. Remember to cleanse, because we've got pollutants and the dust and the dirt and all that. Cleanser, and then a good moisturizer, and then your retinol. The other then nice to haves is, going to be your vitamin E serum and your vitamin C serum and you ferulic acid. There's a whole bunch, CE, ferulic, and all of these nice things.
They can come ask you for that when they're ready for the nice to haves.
Yeah, so it's nice to know what you need.
Yeah.
And then the nice to haves, and then obviously the targeted treatment. So if you have a problem, let's treat your problem. So if we're going to spend money on a serum for pigmentation, let it be the best serum for pigmentation.
Yeah. So, but let me ask you, as we go into these phases of our lives, we were speaking earlier about our perimenopause and our premenopause, and our skins are definitely impacted by the lifestyles that we lead, whether we're exercising, sleeping enough. I'm like listing all my issues here, clearly. But how do these hormonal changes or genetic changes, environmental changes impact our skin? And what's the best way around managing that?
So like premenopause, up to about 45, you can be in perimenopause from 42 to about 51, 50, when the menopause actually then happens. That is your perimenopause cycle. And the symptoms can be anything: dry skin, itchy skin, flaky skin, dry hair, losing hair, teeth that's getting weaker, vision that's going, really buzzing in your ears, not being able to sleep properly, being depressed, being anxious, not getting through your day, not being able to concentrate on your work. So obviously it's not enough decrease in estrogen for you to be medicated in that way. So we need to find, I would say, like supportive ways to be able to identify the problem and then see, okay, there are lots of vitamin deficiencies. We have a lot of them that we don't get enough sun as much as we're standing outside. If you're in your hijab all the time and this is all that's getting sunshine, we're not getting the right amount of vitamin D. So check your vitamin D. Go and check your vitamin B levels. Sometimes we take like a booster or a jab or whatever, but we don't eat the right amount of leafy green vegetables. How many people eat that? Unless you're good and you're making a smoothie every morning and you're getting all the carrots and the vitamin Bs and you're getting, the beetroot into your smoothie, you need probably a supplement for that. There are natural ways that we can also decrease our increase our melatonin so that we can calm ourselves down enough to go to sleep, because those are also things that change with age. Like before, you could stay up till whatever time, get to bed, put your head down, fall asleep. Now you need more sleep, but you have difficulty falling asleep. So there's a no-win cycle already. So we need to find out, ways to make sure that you can sleep better, eating better. Exercising doesn't mean us spending the whole day in the gym. A small brisk walk, 20 minutes, 3 days a week, it's enough. Getting your air outside, it's enough for you.
So, Zaheda, I think you've mentioned some pertinent things about the self-care. And I think it's so important for us to be able to realize that it's not the 20 minutes. It's like you said, you can just commit to putting 5 minutes for yourself to look after yourself. And I like that you also mentioned it's not just about our skin, it's about our hair, but it's our lifestyles that impact and show those stories, but how we keep showing up as our best self. So I have to ask you, you mentioned this at the beginning, and I think it's such a relevant thing that Zaheda mentioned is stop trying to just feel youthful, rather have a more overwhelming desire to make it feel real for you around you. I have to ask you, what is your definition then of a woman who glows, a woman who's glowing? Is it the masks that we're putting on? Is it the facial treatments? What is glowing for you?
I think glowing should start from the inside. I mean, honestly, I think it's important for you to glow. What you're eating must glow. Like your water is enough for you to hydrated skin, nice and plump. It's looking nice and fresh. All the other things are coming. Like, you can put Botox, you can put your fillers, you can have your peels, you can have everything. But if on the inside you're not looking happy, and you're not happy with the skin, it doesn't matter what we put in there. You will never be happy.
Absolutely.
And you really just have to be happy with what you have got. And let us help you improve that, but not with the aim of, I want to be different. I want to be comfortable and happy in my skin. And that's what we should all aim for.
I love that. And just to come back to one of the topics that we didn't discuss in addition to our hydration and pigmentation and that, two things. Can pigmentation actually be sorted and cured?
So I say this when I have my patients, the first consultation is to see the depth of the pigmentation and basically to explain to them that like we get hypertension, diabetes, any chronic illness, asthma. Pigmentation is a chronic disease. We have to constantly be managing it. And if we are not managing it, and it changes. So what your skin is responding to now between 35 and 40, and then suddenly it doesn't work. And that's a lot of patients, a lot of the time, is that I used pretty much everything there is to use for pigmentation. And it doesn't work. And it's not that it doesn't work. It's just that our skin learns to adapt. Our skin's very adaptable. And it learns to adapt to the things that we're putting on it. And it will find a different pathway to create the pigment.
Brilliant. And then when we go to makeup artists and we all want to walk out looking flawless, and we seldom do look as smooth as we would like it to look or as the pictures show it to be, because there's a lot of uneven skin tone and things like that. And many of the makeup artists often repeat and say to us that if you're not taking care of yourself, makeup can't be your quick fix or miracle worker.
That's what I say to patients. There's a group of people, right? There's those people who like great skin, and there's those people who like great makeup. But if you can do great skin and great makeup, your result is going to be wonderful. But remember, very few people put great makeup every single day. So our focus should be great skin. And then when the great makeup comes, it just enhances your look. It doesn't change you completely.
So then I have to ask you, how do we ensure that we're looking after that skin, especially with the uneven skin tone, the open pores, which just gets bigger as we get older?
I must be honest, very important in our 40s, because we are now in our 40s, right?
Yeah.
Reaching our 50s. The open pores and all of those things is because of skin laxity. And skin laxity is from decreased collagen. And if we want to increase the collagen, and maybe a lot of people may disagree with me, but drinking it is not fixing the problem. We need a collagen induction therapy on your skin. And it can be anything. It can be, if you don't have the funds to come and do like a treatment every week in the practice or in the salon, ask them what you can do at home. And there are a few things that can be done, like needling at home once every week to improve your collagen, to tighten your skin. And then those simple ingredients that I mentioned, be good with them. Make sure you do that 5 minutes in the morning, 5 minutes before bed, and then everything else is a bonus. And that's what we're all looking for. We all want the bonus, but we're not willing to commit to the 5 minutes in the morning and in the evening.
And that comes back down to discipline and self-care that we actually owe to ourselves more than anything else.
And it's part of a routine that this is a self-care routine. I'm calming myself down. I'm making sure I'm nourishing the part of me that I see the whole day. And this is the part that sees everybody else. And I'm going to put on whatever I need or whatever I love. And I'm going to bed.
Absolutely.
And I'm going to wake up tomorrow fresh as a daisy because I like what I did yesterday.
Brilliant. Thank you so much, Dr. Zaheda. I think, the time is short, but at least it gives us an overview of what we're facing in our 40s, where to start with it, and how to actually get going. Because I promise you, all of us can commit to at least those 5 minutes in the morning and 5 minutes in the evening. But as Dr. Zaheda mentioned, it's more than just trying to be youthful. It's also the confidence that comes behind it and the confidence that we get with taking care of ourselves. It's not just about filters, but it's the depth behind it. Good skincare is one part, but it's not the entire story. Confidence is also enhanced by energy, by presence, by posture, by kindness, by showing up, by being there. So while you take care of your skin in the way Dr. Zaheda has told us to do, make sure you also love the woman that's living inside of it. Because this episode is about making sure you're not only looking after what's here, it's also about taking care of what's on the inside. Stay tuned for the next one, because what comes next starts here.